Good day everyone, mabuhay! This is Danica of Nimadral and I will be sharing to you the kitchen safety, and that will include the cause, first aid, and the precaution of the common kitchen accidents. One of the common kitchen accidents is the cuts. A cut is a break or opening in the skin. It is also called a laceration. A cut may be deep, smooth, or jagged. It may be near the surface of the skin or deeper. Here are the common causes of kitchen cuts. We have the knife, broken glass, and sharp cooking utensils. If you cut yourself while using kitchen knife, sharp cooking utensils, or even in a broken glass, make sure to put first aid immediately. And here are some first aid procedures that you may need to use. First aid number 1, wash your cuts gently and thoroughly. First aid number 2, apply antiseptic ointment. First aid number 3, wrap with a bandage or gauze. And here are some precautions to avoid and prevent cuts. Precaution number 1, keep your knives sharp. Precaution number 2, wash your knives or sharp cooking utensils separately and store appropriately. Precaution number 3, pick up broken glass with a paper towel. So that was the first common kitchen accident, which is the cuts, with its cause, first aid, and precaution. Now, let's move on to the second common kitchen accident. Common kitchen accident number 2, burns. A burn is an injury to the skin or other organic tissue. Here are the common causes of burns: hot burners on the stove top, oven, hot dishes, and scalding from steam and boiling liquid. If you burn yourself, make sure to apply first aid immediately. To treat burns, you first need to figure out which type of burn you have. These are the type of burns. We have first degree burn, second degree burn, and third degree burn. First degree burn. This involves just the top layer of the skin. It looks red and is painful, like sunburn. When you press on the burned area, it turns white. To treat it, remove any clothing or jewelries that near the burn. If your clothes are stuck to it, don't remove them. Place the injured area under cool running water for 3 to 5 minutes. Apply an antibiotic ointment, never ice, oil, or butter to your wound. Cover it with a clean bandage. It should heal in 3 to 6 days. Second degree burn. This is a deeper skin injury. It turns red, blisters, swells, and to treat it, soak the burned area in cool water for 15 to 30 minutes. Apply an antibiotic cream to prevent infection. Cover the area with a sterile dressing. Change the dressing each day and check for signs of infection. These include increased redness, swelling, pain, and pus. The wound will take 2 to 3 weeks to heal. It will also start to itch during this time, but don't scratch it. Third degree burn. This is a medical emergency. Cover the wound in a cool, wet dressing and call 911 or head to the nearest emergency room. This type of severe burn involves all layers of skin and will have white or black tissue on top. It might not hurt much. That's because the nerves in the skin are damaged. Not sure how bad your burn is? See your doctor right away if it involves your face, hands, feet, or genitals. Number 2, it is on or near a joint such as your knee or shoulder. Number 3 goes all the way around the part of your body like your arm or leg. And number 4 is longer than 3 inches across or goes deeply into the skin. And here are some first aid procedures you may need to use. First aid number 1. Cool as quickly as possible. First aid number 2. Cover with a dry bandage. First aid number 3. Don't break blisters. And first aid number 4. Call doctor if burn is extreme. And here are some precautions to avoid or prevent burns. Precaution number 1. Use pot holders. Precaution number 2. Turn pan handles toward the center of the stove. Precaution number 3. Turn stove and oven off when done. And precaution number 4. Keep small children away from stove.
So, for number 3, first aid for electric shocks. The causes of first aid for electric shocks are: first, worn cords on appliances, ungrounded outlets, and water in contact with appliances. For the precautions, first, we have replace worn cords, disconnect small appliance when not in use, disconnect appliance if it falls in the water, and use outlet covers. For first aid, we have to disconnect the power source first. Remove the injured person from the power source, administer CPR, call for help, and treat burns. For number 4, first aid for slips, trips, and falls. Causes of first aid for slips, trips, and falls are: first, clutter and spills on the floor, climbing on chairs and countertops, and loose clothing. For example, is shoelaces. For precautions, we must keep floors clear, wipe up spills immediately, use a step tool for reach high places, and wear fitted clothing, take off loose jewelry. For first aid, make sure you are not hurt before standing up. Getting up the wrong way could make the injury worse. Slowly rise to your hands and knees. Try to crawl to a chair and pull yourself up. If you can't get up on your own, yell for help. And lastly, if the area is swollen and you think might have a fracture, try not to move it. Call your doctor or go to the emergency room.
First aid for choking. The causes of choking: skin, lips, and turning blue or dusty. Skin that is fluid then turns pale or bluish in color. Causes of choking: food truly cut into very small pieces for small children. Avoid talking, laughing when you have a food in your mouth. The first aid of choking: stand behind the person, make a face with one hand. First aid of eye injury:
What you should do if accidentally shoot lemon juice straight into your eye, or get splashed with bleach or another toxic chemical while cleaning up. Don't panic, follow this step. Lean over the sink and pour a gentle stream of water over your eye. Keep flushing it up to 15 minutes. Cover your other eye to protect it.
The last common kitchen accident is poisoning. And these are the causes of poisoning. We have the cleaning agents and kitchen chemical. First aid procedures that you may follow. First aid number 1. Call poison control and tell them what the substance was that was inhaled or ingested. First aid number 2. Follow their instructions. And these are the precautions to avoid poisoning. Precaution number 1. Keep out of the reach of children. Precaution number 2, use safety locks on cabinet drawers. Precaution number 3, don't mix kitchen chemicals. And precaution number 4, keeping kids safe in the kitchen.